Hello. So for this week's journal entry and discussing a new experience that I had, I would have to say a specific patient, excuse me, that I had who had some dual diagnosis. Excuse me with this video. I do have a dry cough. And with this particular patient, they had a long history of substance abuse disorder as well as major depressive disorder. And they came into the office and stated they wanted and needed some type of help. They had a past military experience as well, and they were still getting the benefits, which made it easier for them to be able to get service, which was a great thing. But he was stating that he had a history in the past where he was using crack cocaine, marijuana, and alcohol, and that he hadn't used any substances in over 3 years. But he felt like he had been recently having some urges, and this was due to some life stressors. The patient was coming in for psychotherapy, and he was also following up with the psychiatrist that was there. He stated that he felt like he didn't have any self-worth because every time he got to the point where he got stressed, the first thing he thought about was using a substance, and that's what made him feel bad about himself. Um, that was the first time for me because although I have learned a lot about substance abuse, I hadn't worked with many patients who had actually had a history, especially a patient who actually seemed that they felt that they were starting to crave and actually tried to get help before even attempting to use the substance. In the hospital that I work in, we do have patients that come in, but most of the time they've already used, and we're trying to help get them clean versus someone feeling like they're about to relapse. So that's why I said this was a first time experience for me. It was a very significant aspect in the H&P role because, well, in this case, it was a psychiatrist. But if, of course, I was a psych nurse practitioner working with this patient instead of a student, I did notice that one of the main things that the psychiatrist did was to encourage the patient to attend therapy and to make sure that he felt that if he needed to talk to somebody and felt like he needed more help, to let them know because there were other options as well. He also offered him some options of medication to help with cravings and to see if he, excuse me, if he wanted to try something like that. The patient did agree, and he went from once a week to, I believe, 3 times a week before I finished my semester last semester. And one of the key aspects aspects of the scenario that I felt that was significant was that he felt like he was just such a bad person, all because of the cravings that he had. Even though he hadn't tried them, he still felt bad about himself, and that was very heartfelt. And it also showed how a person can, no matter how hard you try, sometimes you just feel like the negative side is still winning. And when I reflect on my personal strengths, I felt like I was good at building a rapport with the patient and making him feel like he was in a safe space and not judged at all. So I was very non-judgmental for him, and I think that helped establish trust. And every week that he would come in, I felt like he opened up a little bit more because he said he would usually in the past do these programs and always quit, but even when I finished my semester, he was still coming. So I did notice that this person did really try this time to help themselves. And I think a lot of that did have something to do with him feeling like he was in a safe space and not being judged. Limitation wise, I would say I'm learning every day in school more and more, of course, but the psychiatrist being there was great to offer different forms of medical treatment as well as psychiatric treatment, anything that is possible to help this patient. I do feel like I was limited as in having enough knowledge to offer myself things or bring up certain things that I thought would be helpful. I did, of course, encourage the patient to continue with therapy, but I felt like that was a limitation for me with this patient. Um, what's the next question? I feel like this interaction taught me the importance of balancing compassion and being clinically understanding of what's going on with your patients and understanding diagnosis. I know it's okay to sometimes always not know everything because nobody knows everything, but just to have the basic information in your head to be able to make your patient feel like you do know what you're talking about. So in my case, I was okay because I was a student, but I felt like the psychiatrist handled everything very well and gave the knowledge to the patient they needed to. In terms of growth, this case helped me to realize the importance of continuing professional development, especially in those areas that you may feel that you don't have a lot of knowledge in this particular case, addiction management. And I would like to in the future be able to prove my knowledge and skills to patients who have addiction issues. Like I said, we work with patients with addiction issues in my job, but a lot of the times they come right back because I don't feel like a lot of the times they get what they need. And I feel like if they got more, then I would be educated more. Of course, as an RN right now, we follow the psychiatrist or the nurse practitioner. So a lot of what I see, I don't feel that a lot of the patients get the help that they need, unfortunately, in my specific hospital I work in. But I do feel like where I did my clinicals that last semester, I feel like the psychiatrist was terrific, and he's somebody I would like to, follow in the future. Hopefully, even work with one day. You never know. And that's about it. Thank you.